Good morning. Welcome to the second day of the Northwest Pharmacy Convention. My name is Jenny Arnold, and I'm your staff for the Northwest Pharmacy Convention. Welcome to the Washington Law Update, which will be immediately followed by the current issues in Washington pharmacy practice. And it is my pleasure to introduce Dr. Lauren Lyles-Stoltz. Dr. Lyles is the Executive Director of the Washington State Pharmacy Quality Assurance Commission. Dr. Lauren Lyles was most recently a German Chancellor Fellow researching population health management mainly in Germany and in the US as a solution to the rising healthcare costs and fragmented healthcare infrastructure. Lauren graduated with her PharmD degree from the University of Mississippi School of Pharmacy. Following graduation, Lauren completed her postdoctoral fellowship at the Eli Lilly and Company in the U.S. and International Regulatory Policy and Strategy. She also worked part-time as a pharmacist at a mail-order pharmacy. And following that, Lauren served as the pharmacy manager or the manager of pharmacy affairs at the Academy of Managed Care Pharmacy, which represent the professional interests of mostly pharmacists and physicians in managed care to help facilitate the transition to value-based healthcare. Terry Ferreira. Terry applied for a PQAC commissioner position 5 years ago and was appointed after her involvement in the development and testimony in the Senate of Long-Term Care statute changes adopted in 2015. She was reappointed to her second four-year term and is currently in her second year as vice chair of the Pharmacy Quality Assurance Commission. Terry has practiced in long-term care for most of her career since graduating from WSU in 1991, early on as a consultant pharmacist and later in operations. Her current position is Regional Director of Operations for the Northwest. Besides being responsible for day-to-day management of pharmacy operations, she is involved in technology, both in the pharmacy and in the facilities they serve with the electronic medical record integration. She works closely with the consulting team and the leadership of the facilities to help manage costs while optimizing medication therapy. Terry is a past president of the Washington State Pharmacy Association and continues to actively engage with the association. She is actively involved with the Washington Healthcare Association and Aging Services of Washington. Dr. Tim Lynch received his bachelor's in pharmacy in 1997 and his PharmD degree from the University of Washington in 1998. He also earned his master's in healthcare administration. He is the past president of the Washington State Pharmacy Association and has received numerous awards and recognitions. He is currently the chair of the Washington Pharmacy Quality Assurance Commission and serves as the vice president of pharmacy for Multi-Care Healthcare. Thank you, all three of you, for coming today and for presenting. We appreciate it and look forward to what you have to share with us.
Thanks, Jenny. I'll kick us off. So good morning again, everyone on the call today, and those of you who are joining us via video. Thank you for having us today at the Northwest Pharmacy Convention. We are excited to still be able to connect in this virtual medium during these interesting and unprecedented times. My name, again, is Lauren Lyles-Stoltz. I'm the ED for the Pharmacy Commission, and I'm joined today by the Commission's leadership team, who have been phenomenal in the response to COVID-19 and also leading our efforts through the rule rewrite process that we'll be presenting today in today's presentation. Jenny did a great job with our bios, but I would like for the leadership team to, again, just to reintroduce themselves before we start our presentation. So, Terry, I'll turn it over to you.
Hi, good morning. Terry Ferreira, pharmacist and commission member, as well as current vice chair.
Thanks, Terry. And Tim?
Hi, good morning, everybody. This is Tim Lynch. I am a pharmacist and also the chair of the Washington State Pharmacy Quality Assurance Commission.
Thanks, Tim. So our next slide. Here's our disclosure slide highlighting that we have no actual or potential conflicts of interest in relation to this presentation. So again, the objectives that we plan to cover today are changes to the Commission's staff. As many of you know, we've been working diligently to build our team to support the many great efforts of the Commission. And today we'll also provide tips on the best ways to engage with the Commission through stakeholder opportunities. Next, we will discuss the Commission's rule rewrite voyage and those next steps, followed by updates of the practice of pharmacy and governor waivers due to the COVID-19 implications. And finally, the entire presentation is predicated on how to put patient safety and patient care first while adhering to the law. So these are the objectives that we will cover today, and we look forward to your questions toward the end of the presentation. So this slide here is to lay the foundation for today's update and maybe a refresher for some of you on the call. The Department of Health was established in 1989 to preserve public health, monitor healthcare costs, and to maintain quality standards while providing general oversight for public health. The Department of Health is led by the Secretary of Health, John Wiesman, and John is part of the governor's cabinet, and as such, the department and the boards and commissions are part of the executive branch. The state health officer is Dr. Kathy Lofi, and the slide shows the 4 major divisions and main initiatives of each function at the Department of Health. I'd like to draw your attention to the Health Systems Quality Assurance Division. This division supports the regulation of the health systems and supports the work for the boards and commissions of Washington State. Within the Health System Quality Assurance Division is the Office of Health Professions, which is where the Pharmacy Commission resides, along with 85 to 90, there's several other health professions in the state. The Secretary and the staff of the Department of Health have specific responsibilities that support the work of the boards and the commission. One of those being the Secretary sets the fees for the boards and the commissions. These are done in rule, which includes stakeholders' input. And all staff is hired by the Secretary. This includes the staff to provide credentialing, enforcement, and rulemaking support to carry out the work of the boards and the commissions. But it's important to note that the boards and the commissions, specifically in this case, the Pharmacy Commission, works closely with the Department of Health to build this interdependent partnership for establishing the staff needed to carry on the commission's work. Whereas the department provides the administrative support to carry out the implementation and the enforcement of the standards of the program goals. The governor appoints the commission members to bring expertise and voice of the people to the regulation and the practice of pharmacy. The commission are also part of the executive branch, and I think that's just, again, worth highlighting. The people view us all as the government, so it is best if we are all speaking in a coordinated fashion, which is why it's important that we work with a lot of the other agencies when deliberating on decisions for the practice of pharmacy. The commissions work within the statutory authority granted by the legislature, and the legislature sets the scope of practice. Then within the statutory authority, the commission then sets qualifications for licensure that protect safe practice, set consistent and safe standards, and determine the continuing competency and enforce violations of these standards. These are all forms of the critical roles for the protection of public health and safety done under the commission's umbrella. So the next slide here, we have the commission. The commission consists of 15 members, 10 of those being licensed pharmacists, and you can see in the bottom right-hand part of the screen, our chair, Tim Lynch, along with one of our commission members, Steffi. And so 10 of those members are licensed pharmacists. One is a pharmacy technician, and we have 4 public members who serve the great state of Washington. Again, these are 4-year terms, governor-appointed positions, with a max of 2 terms that are also confirmed by the Senate. Our commission members have expertise in community pharmacy, managed care, long-term care, health system or hospital pharmacy, and several other facets that make up the world of pharmacy, followed by our great public members with diverse backgrounds that they bring to the table, and our pharmacy technician to all give great insight into the work that the commission does. We currently have 3 pharmacists commission vacancies, and we are currently underway in filling those positions. And we potentially will have another vacancy in July. And so please keep a lookout for communications for those recruitment applications that will be sent out through our Gov delivery engine. Next, in order for the commission to support the commission's work, behind the scenes, we have the commission staff. And so in the first column here, you'll see parts of the members for the program staff team, including myself, our program manager, Doreen Beebe, Irina, and we have two new members that we've welcomed to the team most recently, our rules legislative consultant, as well as our administrative assistant that will be joining the team June 1st. And as of yesterday, we have extended an offer to fill our deputy director position. So we're really excited about that. And our new deputy director will be stepping in her role June 16th. So it's really, really a great time to be building up the staff. Next, you'll see we have our pharmacy inspector team. Some of these names may be familiar to you. And the last bullet point is we have one vacant spot that we are currently also in the process of reviewing applications to fill Territory 6, which is around the King County. And I'll show that in the next slide. And in the final column, I wanted to highlight just some of the other offices that we have to work closely with in order to administratively support the Pharmacy Commission. And these are not all of the offices we work with, but the ones that we work with most closely. So our credentialing team, and I know a lot of people might have been interacting with this team a lot these past couple of days as the renewal cycle's coming up, and I know, and I'm completely aware of that. OILS, our Office of Investigation and Legal Service, and Office of the Assistant Secretary that supports our developing of rules and our proposals of legislative agenda items to send over to the legislator's office. So that again provides the background behind who supports the commission staff, and we're really excited to have our new team members. The next slide really is to outline, just to show a graphic of our new employees. And so Danielle Lee, who you see in the northeast corner, she came in and filled a position that was once held by Eleanor. And so we're really excited to have Danielle, who joined the team in February. And so as you can see, that Territory 6 in King County is the vacant pharmacy inspector position that we hope to be filling really soon. So really a lot of great work by our pharmacy inspectors, and this map is just really helpful, and this should be in the slides that everyone will have after the presentation. So moving on and shifting gears a little bit, now that you have the foundation of the Commission's infrastructure, authority, and the staff's composition to achieve the goal for public health and promote public safety, there are several avenues I would like to talk about to engage with the Commission. So the Commission meets every 6 weeks. Usually these are 2-day meetings, but it varies. We have a meeting tomorrow and it'll be a 1-day meeting. And through these meetings, you're able to receive the 3-hour CE credit per renewal cycle for attending. So these are just some of the avenues that you can engage with the Commission. And the next, it's not that slide, but and so the next slide shows who the Pharmacy Commission regulates, and we'll dive into a little bit later, again, how you can continue to engage with the Commission. So the Commission not only regulates the pharmacists, interns, and assistants, and technicians, things that people are probably more familiar with, but their purview actually expands broader to many facilities outside of pharmacy, including the healthcare entities, hospital pharmacy associated clinics, and then some of the most surprising ones to many of our licensees and stakeholders are the Humane Society, dog handlers, and Fish and Wildlife. As you can note here, I've highlighted with an asterisk the pharmacist preceptor position. So this will no longer be relevant after July 1 as the effective date of the new rules. And so this is something that everyone should just recall, and I just wanted to highlight for everyone today. So next, I have here, again, ways to engage with the Pharmacy Commission. I know we have many people who attend the meetings, but it's also really important to participate in the meetings during the open forum session or by submitting your questions or proposals 60 days before the commission meeting. This is really a great way for us to, follow up and really act on some of those submissions that we receive, because we do receive several submissions and questions and proposals. And so this is the best way we can organize that information. So attending and participating in business and special meetings, which I want to say the past couple of months, we've had at least 5 or 6 special meetings in response to COVID-19, and the licensee base and stakeholders have been really engaged with the commission at those special meetings. So we really appreciate that. Next, we do have subcommittee meetings, whether it's the business subcommittee, subcommittee on HPACs, compounding subcommittee. These are also ways to really engage with the commission. I won't go through each one verbatim, but I think generally the commission general inbox is also the best way to reach out or to give us a call if you have any dire questions, and we will try to get back to you as soon as possible. And just understanding the elements of everything going on with COVID. I know things have been delayed, but I hope that we have been able to answer most of the questions appropriately and efficiently. So we really appreciate everyone working with us through that. So I want to take a quick pause and just see if Tim and Terry have anything to add to anything that I've covered, because I kind of just kept going and you're presenting from home. So I want to take a moment to see if there's anything that I might have missed from Tim and Terry.
Yeah, hi, Lauren. I think you did a great job really summarizing the commission and how it operates. One thing I just want to emphasize that you pointed out is there's lots of ways for our public, our stakeholders to get engaged with the commission. And the commission is definitely wanting to hear from our stakeholders. As we've gone through the rule rewrite process, hopefully everybody has seen that we want to work closely with our public, with our stakeholders, always keeping patient safety in mind. And the way we do that is engaging with our community. So if there's a way for you to dedicate your time to that, I encourage everybody to make sure that they come to our meetings, actively participate. During the COVID situation, we had lots of opportunities for that. And the goal of the commission is really to be visible with our public and to make sure that we're addressing public safety issues or concerns that are brought to us. So just encouraging everybody to continue with that engagement.
I have one question.
Thanks, Kim.
I have one question that was asked. Julie Akers asked if the 3 CE hours for PQAC meetings attendance will be changing to 6 credits per 2-year renewal cycle, or if you will limit it to 3 hours per year, how you're going to address that.
So, you would like me to respond? Julie, I think that's a great question, and I think that's something that we've been tracking rules implementation questions currently, and so these are things that we want to bring to the commission if we don't have an answer at this present moment. So I think it's a great question, and Tim and Terry, I don't know if you want to add anything there, if that's just something we can revisit during our rules implementation discussions.
You know, I wish I knew the answer off the top of my head, and I apologize for not doing it. But I seem to recall our discussion on this is that we were going to focus only on ACPE approved credits going forward. And my memory, and it could be wrong, I think we need to validate, was that we were going to go away from commission CE during the meetings and just go with ACPE. But Terry, do you recall any discussions related to that? I know we had it on a few meetings, and that's my memory, but I could totally be wrong on that one.
Yeah, I think that is definitely what our discussion was, but it was more around approving, the non-commission, non-ACPE. And so I think this is a good question because we do want to engage our stakeholders if they could attend our meetings. So we just have to have an avenue to be able to get those ACPE certified, which may mean WCA, right?
We're happy to partner. Yeah. In
All right. Thank
you. You did move away from board approved CE. Thank you.
Yeah. Thanks, Tim and Terry, and Jenny. That'll be one of our follow-up items. Oh, sorry, Tim.
No, I was going to say the same thing. We can take that as a follow-up and make sure we get that answer back to everybody on that.
Yep. Thanks, Julie. Okay. So, and Terry, did you have any final comments to add here on ways to engage with the commission?
No, I don't think so. Thank you.
Okay. Awesome. So, if anyone was really paying attention, you would have seen that my fingers got a little happy and I went to a couple of slides. So hopefully you didn't see the answer, but our first question is, first question, true or false question is, I must still apply and meet requirements for my pharmacy preceptor certification after the new rules are effective, true or false? And then Jenny, would you agree that the best way may be for people to just type it in the chat box and we can see what the resounding answer is, if it's true or false?
That sounds like a great strategy for right now. And I'm sorry, I didn't realize we had questions in. I'll go look ahead on your other questions and make sure to put them in the polling software so that we can better integrate that for the rest of the presentation. So far, we have a number of responses and they all indicate false.
Great job, everyone. So good. So hopefully you just knew that from memory and not because I accidentally went through a couple of slides. And I also just made a note to follow up on the CE. So I just want to make sure we're being proactive here. Okay. So next we have the rules rewrite update. And during this section, we'll talk about the goals, the process, outcomes, and next steps. So now this is a part I'm pretty sure a lot of you have all been waiting on to learn more about the rules rewrite. I also like to say thank you again for those who completed the Commission's short survey on the rules implementation survey that we sent out last week. It's really helpful for us to really gauge who's being informed, what that level of information that base knowledge that you have as we work on strategies to improve how we educate people through the rules implementation. So thank you for everyone who's completed that survey. If you have no clue what survey I'm referring to, if you go to the Commission's website and click under What's New and scroll down to Rules Implementation Survey, it's the very last slide, and it's a 3-question survey that we developed just to say, what do you know about the new rules? Well, now I hope the answer is yes. Do you know the purpose of the new rules, and what's the best way you like to receive information on understanding the rules implementation, whether that be through CE, ACPE accredited CE, or Gov delivery notices. And so we really love your feedback as we go through the implementation development. I will shortly turn it over to the chair, Tim, but want to take a moment to call out the next slide, this slide right here. Here, I think it's important to note that during the rule rewrite process, the Commission did recognize some regulations that needed to address the new rules, but it would require a statutory change, for example, compounding. The Commission has the authority to write pharmacy rules, but any statutory changes require action by the legislature, which is not impossible, but more of a consistent effort. And so I just wanted to make sure that we call that out, that there may be questions of, well, why didn't the Commission address this in rule? And it's really because it's perhaps potentially connected with some type of RCW that would require a legislative change. And those are things that the Commission has noted and that we will work for for future legislative sessions. Again, the Commission values and encourages your input into the rules process. And I hope that many of you felt that you were engaged throughout the rule rewrite. As mentioned earlier, to stay informed, it is extremely helpful to sign up for the email distribution list. And it's on any of our Commission web pages in order for you to continue to stay up to date once we get to a place where we're starting to issue out more educational information and tools. So with that being said, Tim, I'll turn it over to you. Tim, are you still there? I can't hear Tim, Jenny.
Can you hear me now?
Yep,
Okay.
I can hear you now.
I love WebEx and GoToMeeting. It's so fantastic. So as I'll restate what I said. So this next portion of the presentation is really talking through where we have come from and where we are going as a regulator of pharmacy practice within Washington State. Currently, we have 34 chapters in our rule book, and really we want to create a way for our licensees to better understand the rules and regulations that impact how we deliver care from a pharmacy perspective. And I think anybody that's taking the law exam recently has understood the complexity of our rules and laws and what a challenge it is to keep everything aligned and in your head as you practice pharmacy. So really the work that we're engaging is to make that an easier pathway for people to understand what really impacts them from a rules and regulation standpoint. And our philosophy really was to modernize the rules and eliminate conflicting areas in WAC and RCW, or where WACs conflicted with RCWs. And we did find a number of those as we went through the process. And this was a very, very long process. Our current rules are very detailed, as anybody can appreciate. And as you've looked at some of those rules, as we did at Commission, one of the things that we noted was that they were very outdated. Some of the rules had not been updated since the 90s or even before the 90s. And as anybody that's practicing currently understands, the world has changed in how healthcare is delivered. So we just haven't been able to keep up with the contemporary practice. And as people were aware in prior years, we had special approvals granted for technologies and other things that were one-offs. And it was very difficult from a commission standpoint to track those special projects and one-offs that had been granted, and it created greater inconsistencies. And in some cases, our rules right now really prohibit how we can use technology and advance the profession to meet the needs of our patients in Washington State. So we started a project about 3+ years ago where we, after recognizing that we couldn't take given the rule rewrite process, it took 18 months to really write a rule, or with all the stakeholdering and the 101, 102s, 103s that are filed. And going through a few of those, we realized we could not, it would take us a generation to go through and correct a rule as a one-off and address all the inconsistencies. So this was a very challenging part of our work, and we recognized that the only way we could really do this was to start from ground zero. NABP also had a recommendation at that time to really work with the boards of pharmacy to recognize how technology can be used and implemented without the prescriptive rules and regulations that we typically done as a pharmacy regulating board. And so an initiative from NABP, and then we also saw other states like Idaho who had gone through this process and been able to modernize their rules and make them reflect contemporary practice. When we started, the commission's philosophy around this is really stopping the one-offs, making sure it's consistent for all of our licensees, developing specific things that do require commission sign-off. Those are generally in statute, and really looking at how we can make the rules flexible so that they can rely on the professional judgment of the practitioner in terms of governing how we conduct pharmacy practice, something that supports improvement in quality and best practice. And then also for those areas where a small percentage of the regulated community need to have enforcement actions taken. But our general philosophy is that our licensees want to behave in a proper fashion. They are professionals. They want to do the right thing for our patients, and we shouldn't focus our energies on the 1 or 2% that are not really aligned with that goal in terms of patient safety and quality of care. And then also allowing our rules to be contemporary and flexible so we can look at new technologies. As we embarked upon the rule rewrite project, we wanted to focus on a few key things. One is that we wanted the rules to be flexible and contemporary. We knew this was a generational effort, and so we wanted to make sure that our work was something that would be contemporary 20 years from now. That's our goal. The other thing is to make sure that patient safety is paramount. That is a key driver of all of our rules, and that's the mission of the Pharmacy Commission, and why we exist is to protect and promote public safety. We also want to support innovation. We know healthcare is changing, and our rules need to be flexible to allow innovation and adaptation to new technologies. And again, relying on professional judgment is key to make sure that the profession is operating at the highest level. Very, very much less prescriptive rules as we've been accustomed to following in pharmacy. And then lastly on this slide, and I apologize for being a lot, but there's a lot of content here, is the rules, writing the rules and giving technical advice. We want to make sure that we allow technology to be used with some guiding principles that include patient safety, how we license it, how people are trained to use it to ensure patient safety, security and confidentiality of the data as it impacts our patients, record keeping to make sure that we can track how drugs are used and moved within an organization or with technology, a quality assurance project component. Our goal is always to ensure that we're doing a continuous quality improvement for all of our work. That includes our self-inspections, our routine inspections. Is we expect to find things, and the goal is to identify those and improve upon those. We no place is perfect, and we expect that to be the case, and that's our guiding principles around that. And then workflow processes and emergency procedures. What happens when there's a downtime? How are you gonna do this? So those are kind of the guardrails that we wanted to use for technology, really to make sure that we can adapt to things as they come to the marketplace and as healthcare continues to evolve. The other last component with this is that this project, which we've just concluded, covers our 5-year rule review as required by RCW 4370.04. So that helps us achieve that regulatory requirement as well. If you go to the next slide, Lauren. Just to reflect, if you look at our current rules, this is current state today, and I would challenge anyone on this call to say that they know every portion of the rules that are listed here, because it is very complex, the rules that exist. And so it's a challenge for us. Our work will certainly make this a lot easier and a lot more readily interpretable by our public members or our licensees as they use these. The Commission has regulatory authority over individuals, which includes pharmacy technicians and pharmacists and assistants. But we also cover entities that possess drugs and manage drugs, such as wholesalers. So the Commission has oversight not only over people, but it also has oversight over facilities and those that handle drugs. Putting all of this together into a much easier framework will help all those that we regulate be more adherent to the rules that we've crafted. And again, thank you for those stakeholders who were involved in this work, because it really was absolutely critical for us to have your feedback and your active engagement to get to where we have gone. And if you go to the next slide. So again, what you'll note is that the rules become effective on July 1, 2020. We did file our CR 103, so we are very excited to announce that. And the rules are bucketed into, it's a single chapter, bucketed into 4 different parts, and those being general licensing, general provisions, professional standards, and operational standards. and I will talk through a little bit about what's included on each one of those in the next slide. So part one covers the general provisions, and these apply to the practice of pharmacy as well as drugs under the Commission's authority. Some of these areas that include our inspection requirements, prescription and refill requirements, our labeling requirements, record retention, advertising, legend drugs, controlled substance, precursors, and other items. So you can see it's generally the general provisions of operating a pharmacy. Part two covers the licensing for personnel and facilities and production or distribution under the Commission's authority. So these are wholesalers and other things that are required under statute for the Pharmacy Commission to regulate and our people and our facilities. And it talks a little bit about the fees and the qualifications for those that work within these spaces. Part three covers the professional standards for pharmacy personnel under the Commission's jurisdiction. So this is where we get into the professional responsibilities of the pharmacist, how technicians can be utilized, how assistants can be utilized, and other people that work within this environment. It also covers what's considered unauthorized conduct, what's delegatable and non-delegatable tasks, how we counsel refill and continuity of care, and other factors, really speaking to the professional standards that we want our licensees to operate within our new rules chapter. And then part four covers operational standards for all the facilities under the Commission's jurisdiction. So these are where we're talking about the requirements for building standards. Many of you of our stakeholders have brought forward many issues related to the old rules around what's required to be in a pharmacy, the lumens of lights and other factors. So we've tried to address those things in our new rules, really to reflect a new practice environment. Also, how technology is utilized. This has been a major issue as we've seen over the years, is how technology continues to advance and how it can be applied within our licensed facilities. This addresses that. Also management of drugs within those sites. So that's really a summary of the four parts to the single chapter 246, 945 that will come into play in July. Next slide. So again, just an overview of the new rules. The current WACs, amended WACs and newly created WACs are going to be incorporated. HPACs are also included. Current practices, including current policy and interpretive statements, are available as well. And then updates to old practice, eliminating redundancies, again, going back to our standard of professional judgment, are all things that are included within the new rules. Next slide. Okay. And then some things that we need to focus on in terms of the new rules versus the old rules. Currently, we have a 1-year renewal cycle for pharmacy personnel that will be changing to 2 years. The 1,500-hour intern tracking and sign off by a preceptor is no longer required for pharmacists that are graduating after July 1, because that is incorporated in the formal training. Pharmacy intern registrations can now only be renewed twice, and that allows for a 6-year duration for the license. Also, we had some changes with the appointment and replacement of a responsible pharmacy manager. On the old standards, there was a requirement for immediate notification, and I think anybody that's been in that situation asked the question about what does immediate mean, particularly if you're having to fill that. That is going to be changing to 30 days after the position has been vacated. And also there was an immediate notification to the board. The new standards will require that to be reported within 10 days, so it gives the organization time to find a suitable replacement. And then also in terms of controlled substance inventory, we're requiring that for the incoming pharmacy manager within 30 days of an appointment. We did not have a requirement at all in the prior standards. It was best practice, but it certainly wasn't a requirement. And with that, I will turn it over to Terry.
Okay, thank you, Tim. So I've got some continued operational changes, so updates on some of the rules. So this has been questions for years on counseling. So we've clarified that the pharmacist must offer to counsel on new drug therapy or changes in therapy. We clarified what the required elements of a prescription are now in regulation. Prescription transfers must be by electronic means, which does include facsimile or faxes, which has been questions and issues in the past about what electronic entails. With that said, in emergent situations, pharmacists may perform verbal prescription transfers. For continuity of therapy, refilling prescriptions allows a pharmacist to renew a non-controlled prescription one time in 6 months if unable to get a hold of the practitioner, and must communicate that information within 1 business day to the prescriber. Okay, Lauren. Then we have new prescription adaptation rules, which allows pharmacists to make changes to the quantity, the package size, and dosage form without prior provider approval. Differential hours requirements are no longer in rule. Specialized function approval has been removed from the rule, and pharmacy technician functions are now left to the discretion of the pharmacist based on the staff members' education, training, and skills. As Tim noted, minimum facility standards establish the base criteria that all facilities must meet in order to dispense drugs. And lastly, set standards for drugs that are stored outside of a pharmacy. Okay, Lauren. Continued, and again, these are just the significant changes that have been added into the rules. It allows a pharmacist to partially fill an opioid prescription. Temporary practice permit expanded to allow an out-of-state intern to receive a temporary practice permit, which has been an issue in the past, which we've been able to add into the rule. We're actually adding electronic systems are updated to require all pharmacies to use electronic system for patient medical records, prescriptions, chart orders, and controlled substance records. Rules for pharmacy storing, dispensing, and delivering drugs without a pharmacist on site establishes standards that a pharmacy would have to follow if they do store, dispense, or deliver without a pharmacist on site. So add some additional boundaries for technologies and allowance for technology in dispensing and storing. And then new reporting requirements for a wholesaler who receives a suspicious order. So next slide. So in summarizing this, again, it talks about the 4 different buckets in one chapter. You've got part 1, which is the general provisions. I'm not going to go into these in detail as we have 15 minutes left and we have a couple of others going, but I know Tim did a really good summary of what those include. Part 2 is the general licensing of both firms and registrations of others, including researchers, shopkeepers, animal control, and others. Part 3 is the professional standards, really to work within our profession to not only include continuity in therapy, but delegable and non-delegable tasks, as well as work with working with your ancillary utilization plans and working with the pharmacist on determining what those will be. And then part 4 is the operational standards. Okay, next slide.
Thanks, Terry. So where are we now? I hope licensees and stakeholders have reveled in the fact that this is a huge accomplishment for everyone in the practice of pharmacy in Washington State. Our next milestone is that I will be presenting tomorrow at the commission meeting on implementation plan, discussing some of the things we've mentioned on today's presentation. Again, stakeholders' input and insight is valuable for how we can best educate our licensees moving forward from here. And so the timeline at a glance is just to show some of our current efforts as part of the implementation plans of the rule rewrite. As you can see at the beginning of the year, pre-COVID-19, we conducted an interactive activity during the January commission meeting just to get people to start thinking about how would you describe the rules? What's your current understanding? And what was the purpose of the rules, which we also mentioned today. And then WSPA did a really good job about continuing holding the new drug, new law presentation. I'm just now seeing an error under March, but this is where myself and other staples in Washington pharmacy law were able to present both on the eastern side and the western side of the state about what some of those updates look like in the new rule rewrite. And I thought that was really effective for those who attended that. And I'm sure there's still some materials from that meeting. Again, as you can see, on May 29th, I hope to get approval for the implementation strategy that I'm putting forward to the commission. But also getting feedback from stakeholders and commissioners during the call to see are we thinking of everything to make sure everyone's well informed. Everything else on the timeline is really not arbitrary, but it's really flexible. These are just some milestones that we're looking into as being a way to really section off how do we address issues such as the CE question. Is it the 3 CE requirements if we partner with WSPA, or the 6 CE? And so really clarifying some things there. The one thing I do want to call out is July 1, which is the rules effective date. And toward the end of the year, we will do some type of gap analysis to see where are there still questions among licensees in understanding or interpreting / implementing and working under the new rules. And again, please continue to engage with the staff and the commission for us to work through any technical assistance that we can provide throughout this rules implementation time. Next, we have our next question. What is the Washington Administration Code, aka WAC, for the new chapter? And so, Jenny, please let me know what we receive in our chat box. Oops.
I will
sure what happened there.
Whole question here. There we go. Everybody has a chance to answer on their screen. The presenters you can't see very well right now, but there is a poll up on the participant screen right now that asks, what is the Washington Administration Code, WAC, for the new chapter? And there's a variety of different answers, and the right answer is embedded somewhere up there. We have about 30% of people voted now. So for those participating, you have questions put up on the screen. Please weigh in. Still have a few more coming in. I'll give it 5 more seconds. Alrighty, I'm going to close the survey and share the results. So 71% selected 246-945, and 20% selected 901, and looks like 5% selected 246-865.
Okay, thanks, Jenny.
And
so the correct answer.
Yep,
go.
I was making sure we were covering that. Go ahead.
Okay, and so the answer here is item B, 246-945 is the new WAC for the new chapter that will go into effect. I can't say it because it's the next question. So when are the new rules in effect?
Okay, so that's the second poll question up on the screen. When are the new rules effective? June 1st, 2020, June 11th, 2020, July 1st, 2020, or July 30th, 2020. Oh, people felt better about this one. We're getting a lot more responses.
Great.
And they've got it down. So I'm going to close this poll here. And so as you can see on the screen, 96% said July 1st and 4% said July 30th.
Awesome. All right, good job, everyone. So I'm going to represent. What, is the poll closed, Jenny?
It is. So let me make sure that you're the presenter. It looks like you are the presenter.
Yep.
There. Hide. Okay, we should be fine to move on. Why is it not moving on? Fascinating.
Oh, here we go.
Okay.
So again, oh, perfect. So again, sounds like 96% of our attendees got the answer correct. The effective date of the new rules is July 1, 2020. So great job again. Okay, so we're almost toward the end of our slide. So bear with me and take another sip of your coffee. So this slide really is to highlight some of the deliverables that we're working on to share with licensees and stakeholders. One, again, to highlight what's the foundation of why the commission went through the rule rewrite process that Tim alluded to. So you'll see a letter from the chair in the upcoming NABP newsletter and future communications. We're starting to collect FAQs. Again, these are things that we would bring to the commission so they can have a full discussion with the full commission to say, you know, to finalize what was that interpretation, or what does that mean, or how can we further clarify. Let me go back. Am I still presenting, Jenny? It
Yep.
kicked me out for a second. Okay, great.
Have a reset.
Okay, perfect. Next is the crosswalk is something that we've been working on the old versus new WAC, so you can easily identify where the old WACs are within the new WAC. And so that's something that we are currently working on, and all of this will be posted on the commission's webpage. And so there will be some links in this presentation, and for those attending the commission meeting tomorrow, there will also be links in that separate presentation. So hopefully you'll be able to find what you're looking for. And again, some of these things have not been developed yet, but they're in process. And that's why I say I strongly encourage everyone who does not currently receive GovDelivery updates to register, and that subscription can be found on the Pharmacy Commission webpage. Again, we want to continue to collaborate with WSPA, WSHA, other stakeholders who are interested in just helping us get the message out and get out good information. I think that's imperative during these times, as well as partnering with the schools for making sure that the students are up to date with information, with the right information. So I'll go to the next slide. These are some of the FAQs that we've received so far. What's the purpose of the rules? You know, how long did it take? When does it go into effect? Where can I find information? And so these are just some of the things that we're starting to compile. And I think everyone on the call today is going to be prepared to go share that good information, since you've been able to answer most of our questions. And this slide is more of a summary slide just to highlight, one, we're in the phase 2. And so this was an implementation PowerPoint that we distributed in January, just letting everyone have more insight into our thinking of how we're trying to educate people, just some of the avenues that we're trying to take, whether it's education and doing these webinars, academic detailing, mailing out pamphlets, making sure that our pharmacy inspectors are armed with the right information for the licensees. And again, at the end of the year, to do a gap analysis to see where are the education gaps and how can we help improve those or close those. As we've come to the end of our presentation, this is our COVID-19 page, and really what I want to call out here for those who may not be in the know is the Plan 19. I know we have had some questions about, the governor's waivers. Are these up to date? And I know there's been some confusion around that, and I hope that our PQAC team has been really great in responding to those questions. And I do just for clarification on the call, that Proclamation 20-36, that includes the waiver for AUP approval requirements, specialized function requirements, pharmacy location requirements, licensure for manufacturers for hand sanitizer. All those are in Proclamation 2036. And when we send out an update, if there is an extension, it may say 20-36.1 or 0.2. Those are just extensions of the 20-36 waiver. So I just want to clarify that, that those are still being extended until July 8th. and that can be found in our live plan, which we are really doing our best trying to keep that updated as possible. And again, for the COVID-19 approach, the commission conducted about 5 or 6, Terry, correct me if I'm wrong, but about 5 or 6 special commission meetings twice a week to try to respond to issues related to COVID as quickly as possible. And so you can find that here, our statements here, and we've archived all of the Gov delivery notices that we sent out here on the website under What's New. So I know we're coming close to time, so I just want to say here's a resource page. Here are the contacts, and as you can see, the second bullet point is our COVID-19 page.
Lauren,
And I'll stop there. Mm-hmm.
Lauren, we actually have until 11 o'clock. So if you wanted to cover some details, open it up for questions. I invite you to do. Sorry about that.
Yeah, I also.
Okay.
Sorry, and maybe if we have time, I can go back to that summary page because I thought we only had until 10:30 as well, and we can go over that a little bit more when you're done, Lauren, just so that we can spend more time on it.
Okay, great. Which we can go back to the summary page. Terry, are you talking about the rule rewrite summary page or this page?
Yeah, the end of my it's slide 23.
Okay.
Which had the 4 buckets. Just kind of go over it a little bit more because I kind of skimmed over that, so we can summarize that one more time in case anybody has any questions. Okay, so again,
perfect.
Just to summarize again, so it's chapter 246, 945. There are the 4 buckets. Again, part 1 is general provisions. General provisions has all of our definitions. There's some new definitions in there, which will aid in helping to review what's in the chapter to follow. Subpart A is operations. Subpart B is where you'll find your prescription labeling, records, and advertising information. Subpart C is legend drugs and your controlled substances. And then subpart D is home dialysis. And, we significantly reduced the number of pages from like over 200 to less than 100. And I have to say that the Legend Drug and Controlled Substance Act is probably a quarter of that. So just wanted to point that out. Part 2 is general licensing. Subpart C, pharmaceutical firm licensing, has pharmacies and HPACs, non-resident pharmacies, HCEs, and then the wholesalers and the manufacturers, and then registration of the researchers, shopkeepers. The professional standards is the one I really kind of wanted to focus on because we spent a lot of time on that one. So that includes the pharmacist professional standards, working within their standards throughout all of the pharmacy practice, and then also defines the responsible manager and their responsibilities. With delegation of pharmacy functions to ancillary personnel, and then really the guardrails on those tasks that a pharmacist cannot delegate. It includes those updates in patient counseling, requirements of a patient counseling on a new prescription or any changes, renewal of chronic medications discussed earlier for that continuity of therapy. Again, that's one time in 6 months if you're not unable to get a hold of the provider in a timely manner, and must respond or must communicate with the prescriber within 1 business day. Prescription adaptation that allows you to change I gotta go back to the adaptation allows you to make those changes in the dosage form that we've not been able to do in the past, and quantities when those dosage forms change, and others. Again, continuity of care, prescription transfers, requirements of electronic, which also includes fax, unless it's an emergency situation where you would be able to do an oral transfer from a pharmacist. Prescription drug product substitutions, and this is where CDTAs live as well, which has not changed. And then part 4 is your operational standards for pharmacies, healthcare entities, and hospital-associated clinics. Goes over the staffing supervision, access, drug storage and security, the record keeping, dispensing on-site, off-site, off-site pharmacy services, and the destruction and return of drugs. Subpart B is registration, and then Subpart C is drug distributors. And so going back to the one slide where Tim showed all of the WACs that we currently have, it'll be important to be able to look at that crosswalk so you can see where you looked before and where it is now. But it should be much simpler and much easier to find and understand clearly what the responsibilities are. Lauren, do you have anything to add to that? Oh, you're on mute, Lauren. Still mute.
I have my unmute sign to remind myself. Yeah, I was just going to say, I thought you hit it. And again, this is something that we talked about at the new drug and new law presentations in February and March, just really trying to say, like, if you want to find X amount of information, this is the part you need to look at. And then again, to your point, the crosswalk, we hope to, it's going to be a really comprehensive crosswalk that we're working on to make sure that you can see where those actual changes have happened. And what we posted on the website last week was our significant analysis again. I think that's about, I want to say it's about 70 pages, but I can't remember exactly. But again, that is really helpful to see where those changes occurred and why they occurred. And so I encourage everyone to also go review the significant analysis that we posted on the website along with the adopted new rules after filing our 103.
And I just put those in the questions panel. I put the links to both the draft rules as well as the significant analysis, and I will drop them into the handout section as well.
Great.
Thanks, Jenny. So with that, sorry, I was thinking that we were running out of time. I want to touch back. Jenny, did you have a comment?
I have some questions when you're wrapped up with this, but I think why don't you finish up your comments? They're not burning a hole in my pocket here.
Okay. Let's see. So just to go back to the implementation deliverable page again. So there goes the revised significant analysis that Jenny was referring to, that was part of the implementation deliverables that we're working on. And I would tell you that is a really good resource. And then we're working on updating the 2020 pharmacy fact sheet. So if many of you remember, that's kind of that quick reference of what the fees are, what has changed, what is the renewal cycle. So we're working on updating that so you can have a quick reference, and then the PQAC pamphlet, which kind of talks about the 4 buckets. What were the significant changes? And again, what is the intent? Because the why is always really important in any situation. And so I'm glad that we took some time to really clarify that for everyone who might be new to learning that the commission went through a rules rewrite, which after some of the survey results that I'll present tomorrow, majority of everyone is aware that the commission went through a rule rewrite, but it was about, I want to say, 30% that wasn't aware. So I think just making sure that we get the word out that this is happening. And then going back to just the COVID-19 approach, I want to take this opportunity too, and Carrie will probably agree with me here, is just to say thank you to everyone on the front lines. This is something that, I wanted to do even a while back in the gut delivery, but I think we've just kind of been head down and trying to respond to just all the several inquiries that have been coming into the commission to say thank you for everyone in the community setting, the hospital settings, long-term, care, every setting that has been working in the COVID-19 response. It has not been easy, I'm sure. And so I just want to publicly say thank you to everyone, and also thank to my staff and everyone working behind the scenes to really just try to respond as quickly as possible in something that no one was prepared for. And yeah, I think that's just important, and I'm not sure if we all say it enough, but thank you, everyone. And with that, I will again say this is our commission resource page, and here's the contact information. And thanks everyone for attending the meeting today, and it's been really great to virtually connect with everyone.
Thank you both. I have one additional comment on the rules rewrite process, just to fill in that there were WACs that the commission wanted to amend and change, but that it would require RCW change to make that happen. And so I know that you all are crafting your legislative ask, because RCWs need to be changed by the legislature. So you saw opportunity there that you will be addressing in the coming years in the legislature, hopefully. And we will need the entire profession's support to make that happen. And then I think tailing on your comments just now is that you had some wonderful comments on COVID. Do you have any insight on the potential for extending some of the COVID waivers that have happened, particularly around tech supervision, allowing them to work from home and be supervised from home, and some of those safety guards that I think in many areas of our state are still pretty important to have in place? Do you have any insight on that?
Jenny, that's a great question. I believe those have also been updated. Let me follow up on that one because the legislature has been pretty consistent in extending them all. And so we just, get a quick update saying, hey, these have been extended to X date, and we try to upload that in our Plan 19. But I'm glad you called out the tech supervision one. I need to double check. I believe that one has been extended. So I'll follow up and we'll send out a gov delivery for everyone to be aware that it has, and we'll update it in Plan 19.
Great, thanks, Brad, for that great question. I have
Thanks, Brad.
A couple of questions relating to transfer and of medications. One of which I put in the transfer of unfilled or on hold prescriptions. That was the policy that you all had with regard to being able to track and have a prescription number to track any transferred prescriptions. So I shared that through the chat box with individuals. But someone else also asked about with the electronic requirements for transfer prescription. I guess some pharmacy chains have the inability to generate a fax transfer. Do you have any insight on how they might need to handle that, or have you heard about that? That was a question from Andrew Hines. Or if you want me to unmute him to ask more.
Yeah, I haven't heard that issue. Have you, Lauren?
No, I haven't heard of the inability to generate a fax. That's a new one. I just know, some of the systems don't talk to allow for electronic transfer, and so the pharmacy would have to do a fax.
Yeah.
But I haven't heard of any issues.
Okay, so it sounds like we'll need more insight on that issue. So Andrew, if you either want to raise your hand to speak up on that, or just provide more information to the commission so they can follow up on it and get more clarification on that.
Jenny, I will also add, if Andrew emails our general inbox with saying, in the subject line, put rules implementation question, this is something we can just follow up on if it actually is an issue, and if he can put what that actual issue is.
Great, thank you. There was also a question about refilling prescriptions. So our new rules allow a non-controlled prescription to be refilled one time in 6 months by the pharmacist, and that they must notify the prescriber within 1 business day that they have authorized that refill. And the clarification was that's not just during emergencies. That is just baseline. The pharmacist has that ability. I think I would add, from what I heard, the tone of the commission was you wouldn't just do this for every refill. It'd be if the patient needed it to be able to offer that extension. So it may be as urgent to the patient, but not during an emergency, public health emergency only.
Right, that's right.
Exactly.
And it would be after attempts to reaching the doctor has been unsuccessful.
Yeah, so you still need to fax the request.
Right.
Thank you. Andrew went ahead and raised his hand. Let me go ahead and unmute him. Andrew, you're self-muted.
Is that better?
Yep.
So I guess in regards to the controlled substances, many times when we call mostly chain pharmacies and require or request a patient profile transfer of all medications, almost every time the pharmacist is like, okay, there's a controlled substance, I can fax everything else. My system won't let me fax an Ambien or an Alprazolam, let me give it to you verbally. So are there going to be requirements that those pharmacies change their software, or are we just going to continue to take those controlled substance verbally from those pharmacies?
Terry, what are you thinking?
Yeah, I think we'll have to take that back and address how we would handle that.
And it's the software that won't allow it, correct, Andrew?
That is correct. Yeah, the pharmacist would state, my system won't allow me to fax this prescription or generate a fax transfer of a controlled substance. So I'll give it to you verbally.
Carrie contributed that Walmart, it says that about their system.
Oh, okay.
Okay, and is there any way to get Andrew's email address? Because I think it's really important that we capture all of it. I have my notes, but then sometimes when I look back, I can't read my handwriting, so.
I'll connect you on that one, no problem.
Okay,
thanks.
Okay,
Jenny.
great.
Yeah,
Andrew.
I can see how that would be an issue, but I just don't remember it being brought up during our stakeholdering process. So we'll have to address it.
What Julie Akers contributes is that they don't have physical fax machines at their location. They use a fax app in their system.
Mm-hmm.
Ah, okay. Thanks, Julie. That makes sense.
Yeah.
And Brad, Hannah pointed out that the specific proclamation he was wondering about was 20-32 for the extension of technician supervision.
Okay.
Any
Thanks, Brad.
individuals, if you want to ask questions of Lauren and Terry, you can use or continue to type in questions. This is maybe, I think, a little bit more of an ethics question by Simeon Roth. Are pharmacies required by law to transfer prescriptions when requested by another pharmacy? They interacted with pharmacies that refused to transfer prescriptions.
I don't know if that was changed in the current WAC or in the new WAC. I mean, current state. I mean, it's really it's at the patient's request, correct? Yeah. For a patient transfer. So, I mean, we can follow up with that, but I thought the transfers were really at if a patient requested it to transfer to another pharmacy. I know I've received a question about can some companies do it automatically, and I think that does infringe upon some of the consumer protection laws that sit outside of pharmacy, and I think you do have to have that patient's consent. So, but it's not ringing a bell of where we call that out in the new rules, so I would have to double check that one. And I mean, Jenny, do you have any comments on this one either?
No, I think it gets to be more of an ethics issue, and oftentimes I've heard of pharmacies will request that the patient request that just to make sure that that the patient knows and is interacting in that. So I know that I've heard, and I think that I've interacted just personal with situations where maybe a pharmacy is transferring something, but they don't realize that the patient is under a medication review, has a pain contract, not a medication review, but getting pill packaging or something like that. So I think that this is that gray, more ethics area than necessarily a legal issue would be my my experience. But you all have worked in this world.
Yeah.
Yeah.
I do think it falls under the Consumer Protection Act. So, but if there's a follow-up, we're happy to take that question back if you'll send it to us in our general inbox. That's my initial response.
Yeah. A little bit more of a follow-up on the transferring of controls. Victoria Elijah types that their software does not transfer within the software, but they can generate a paper copy of the prescription and then scan that into the system as a transfer. And is that acceptable? Sounds like
It sounds great. See, I mean, and it sounds great. Again, I think the whole goal, and this is why, you know, the whole goal with the new rules, I think it's tricky, but it's also an opportunity, right? Because the commission has set these guardrails for people to work within. And so this question that you're saying, so they want to print off the controlled substances and then scan it back in to transfer.
Victoria, do you mind if I unmute you just to be able to contribute? And then I see after Victoria that Mike Donahue has his hand raised. So Victoria, I've unmuted you. You can unmute yourself and clarify what it is that you do as a workaround.
My question, can you hear me?
Yep.
My question is, within our software, we can't do an auto fax to transfer, but we can produce the prescription had been scanned into the software, which we can see and print. So I'm wondering if we printed that copy of the prescription, could we use that with a cover sheet and submit that by fax?
To me, I think that's exactly, I mean, that falls in line with what the new rules are saying. Yeah, I think in Andrew's situation, it was just because they don't have a physical fax machine, and whatever application that they're using, it doesn't allow for that. But I would imagine that printing off the prescription and faxing that for a transfer is what we mean by prescriptions must be transferred by electronic means.
Thank you.
Yeah, as long as it has, as long as it has all the information, the original written date, how many refills are left, and that would seem like that would suffice. Yeah.
And that would apply to mail order pharmacies as well as our in-state pharmacies as well. I think it sounds like we have enough here to potentially put up a frequently asked questions or a policy and procedure around this. Mike Donahue, to round out the discussion, had noted that there has been some concern about pharmacies prescription harvesting and just doing transfers, trying to get more patients. Clearly that falls under the ethics issues, and so that can be safeguarded a little bit if you include the patient in that transfer. So a lot to chew on there for a while. I'm just reading through more questions here. Another question on controlled substances and a C2, a forwarding of a prescription versus a transfer of a prescription. But I think that the quality assurance, Ahmed, in the chat box, I linked the policy for prescription transfers, and I think that answers the question. And then Steve Singer had something really helpful to contribute, that you should probably send a copy of the new rules to your software vendor so that they can make sure that they are complying and aware of the new rules and can make sure that the software updates meet the requirements in our law. And I think that's a great comment because most of the vendors want to know. They just aren't necessarily keeping an eye on all the laws in all the states. So that would be very helpful for your software vendor, I think.
Thanks, Steve.
Great. Other questions? And yes, Epic and other software, all the electronic medical record systems as well. Thank you, Jennifer, for that. Mike Donahue, I think we rounded out your comment, but I'll go ahead and unmute you if you have something else to add, and then Elizabeth after him.
Yes, thanks. Thank you. One other thing to consider with the transfer situation is, and I'm sure Terry can relate to this, if perhaps you lose a home to a competitor, you could have 800 or 900 transfers that they request. And if you try to mandate that, you know, that's an awful lot of work, uncompensated work. And, you know, so whenever we've done that, we haven't refused to do it, but there's a cost if somebody wants us to transfer 800 or 900 prescriptions. It's a cost of doing business. So I would caution the commission to try to make transferring mandatory, you know, or at least be very careful about how you go about that, so that you know, you're not infringing on or forcing some situations that are bad. I think there's a lot of situations that could arise where a transfer, you know, might not be an appropriate thing. It's rare, but it can be significant.
Pain contracts and all sorts of reasons. Thank you, Mike. And then
Thank you, Mike.
I've unmuted you.
I was wondering what the driving reason behind mandating electronic transfer was.
Are there any comments for Elizabeth on that one?
Yeah, oh, sorry, this is Terry. Yeah, you know, in the stakeholdering, we had lots of discussion around this, and, you know, the current WACs regarding prescription transfers requires it to be from a pharmacist to a pharmacist, which has been really restrictive, and really with technology and abilities to do that, we wanted to allow for an electronic ability so that we could spend more time on patient care.
And that makes sense to me, but saying they have to be electronic, maybe it sounds like somewhat restrictive.
Yeah, and you know, in the rules we did add the, you know, in an emergent situation, so your fax machine is down, it's on the weekend, you're not able to communicate, their fax machine is down. Those situations would be perfectly appropriate to have a pharmacist do that verbally.
Sure.
Mm-hmm.
Thank you.
And so, a couple more questions that came up here. I have people texting me questions now too, so let me ask some of those. I'm realizing for students who will be taking the law exam in July, can you just briefly say talk about the efforts that you've taken to make a fair and equitable test, I guess, for them based on the new versus the old rules?
Sure, Lauren can take this.
So,
we were talking about that.
Yeah, no, great question. And stay tuned, Gov Delivery will be coming out soon. So when the rules go into effect in July, what we've done for the past several months is remove those outdated questions from the outdated questions from the rules or from the question bank. And so anyone taking the NPJE after July 1, everything that you've studied from this school year will still be on the test, but any information that is no longer relevant has been removed. As far as new questions, and I've been in conversations with the deans from the beginning, having this conversation to make sure that we're all on the same page as far as strategy to keep everyone prepared, and because no one's trying to sneak one over on anyone, and so there, the new questions that we've developed will be in the future or next year's NPJE. And so it has to go through an internal process at NABP through their subject matter expertise on making sure that the competencies are still met, we still have the right numbers, a lot of details on that end. So it takes time to even get new questions into the MPJE question pool. So that was a long kind of winded answer to say that everyone should be really prepared to still take the MPJE without having to study the new rules as of yet after July 1. But this is something that we'll continue to work with the schools to make sure that they have the up-to-date information, once again, the new rules for next year's MPJE. And we'll send out a follow-up communication on that.
Great, thank you. And so the conflicting questions have all been removed so that they don't get caught in the old rule debate. And that
exactly.
So there'll be asked questions on probably on the new rules, but those are probably more the trial questions at this point than true active questions on the exam.
Yes.
Perfect. And then, one more question on the chat is, are you going to be monitoring the one-time refill in 6 months to make sure that there's not an abuse of that by pharmacies, either a mail order pharmacy or just a certain pharmacy within our state? And I think the answer probably is with most things it'll be complaint based probably. And
and what I
go ahead, Laura.
Go ahead, Terry.
I was just going to say, complaint based, and then through your inspection process, having those discussions and seeing what your policies and procedures are.
Yeah, and I was just going to add that, I mean, everyone still needs to go read the new rules because, I mean, we did summarize a lot of things in the slides today, but there are, I want to say at least 4 or 5 provisions under that section talking about the pharmacist is able to refill. Terry highlighted one being chronic conditions, but there are some other provisions that need to be met to meet that refill. And then to Terry's point, that the inspection process and complaint driven would be another way that we would respond to those.
And one more comment is I think that some of our rules rewrites address some of the waivers that were needed from the governor's office, and will they be updating, or will you be updating kind of the new rules when they go into effect for the waivers, old versus new rules, and make sure that those are written in, that we get the waiving of the new rules, not just the old rules that are listed under RCW. But also, I'm excited. I think there's some flexibility in our new rules that will really help during times of emergency also.
Okay, so just to make sure I got this, so that person is asking if we're going to update the waiver information to reflect the new chapters if the legislature decides to extend the waivers past July 1. Is that the question?
Yes.
Yes, that would be our goal. That's on one of our to-do lists, where we would be updating if the legislature decides to continue to extend it past July 8th, which I think was the last date that I mentioned earlier. We would update it to reflect the new WAC.
Great, thank you. Well, we covered a lot of ground. I think this highlights the importance of staying engaged with the Pharmacy Commission, coming to the meetings, and hearing these important discussions. The WSPA will also be doing work to put out new CE on the new rules, as well as a new technician 8-hour law update here in the next month. My next to do now that once the convention is over, and so we will have resources as well available to the pharmacy community. Thank you both, Terry and Lauren, for your participation, and Tim, who had to leave a little bit early today. We really appreciate your insight and expertise. And now we're going to change gears and move over to the Washington practice update with the WSPA crew. So you all are welcome to stay on, but we'll shift gears and go over to the new CE here. Thank you.
Thank you, Jenny.
Thanks for having us.
And thank you for the support of WSPA and all of your support through this process. We really appreciate it.
Thank you.
Yeah,
We
thank you,
appreciate
guys.
the hard work you guys have done. Thank you so much.
All right, have a great one. Bye.